Can medical writing complement a career in clinical practice, or is it more suited for those who are looking to transition into non-clinical roles?
You are somebody who now wants to do a non-clinical role, definitely medical writing is a very, very lucrative option. Freelance medical writing, if you can just Google it, there are a few books by doctors themselves or medical writers that are available on Amazon also.
What advice would you give to MBBS student or a graduate considering a career in freelance medical writing?
That patient profilers have become very, very popular in medical writing. So these are a few trends that aspiring writers can find out about.
All right, ma'am. Thank you so much for providing insights about the trends. So the next section is learning and growth. So how do you continue to learn and improve your skill as a medical writer?
See, personally, I have always, loved reading a lot. So even for this particular field, I read a lot online and also offline. So I read a lot of blogs on various healthcare topics because I basically am just, understanding what kind of healthcare content people are putting out there. I read a lot on LinkedIn. So LinkedIn posts by fellow medical writers and content creators. I get to learn from them. I talk to people in my network. So from there, I get some insights, which particular area of health and wellness is doing well, which area is not so lucrative, and all such insights I'm able to get. And I keep upskilling. So recently, I took up a medical writing course by Tanya Sultana, which is there on Udemy. I think her course is a breakthrough course because in her course, she has actually, she has guided on how you can write a medical content piece from scratch till the end. So again, I keep taking up courses. I have also subscribed to a lot of newsletters by medical creators. And YouTube videos are also a good source, to learn what are the trends in medical writing or how you can improve as a medical writer. So this is something you can do.
All right, ma'am. As you have mentioned one of the resources, also there are any other resources, books, or communities that that you would recommend to the budding as medical writers?
Yes, so I think resources will be YouTube videos on medical writing because they're completely free. The Right Clinic platform, which I mentioned, they have a free 61 medical writing tips guide, which you have to just put up your email ID and you get that. So that is a very great resource. Apart from that, I think there are also published books. So I think freelance medical writing, if you can just Google it, there are a few books by doctors themselves or medical writers that are available on Amazon also. And communities, I think on LinkedIn, there are a lot of medical writing communities or groups that you can join. You have to just type medical writing groups and there will be a list of different groups. I think Right Clinic also has their own group and it's a really, really helpful group.
All right, ma'am. Now moving to the next segment, that is scope for medicos in medical writing. So, ma'am, what do you think? What are the what advantages do medicos have in the field of medical writing compared to non-medical professionals?
So I think it is quite obvious because medical writers are creating medical content. So if you are a medical professional, healthcare professional, so you could be a doctor, you could be a physiotherapist, a nurse, or a nutritionist. I think all such healthcare professionals will have an upper edge over non-medical professionals simply because they know their topic well, right? If you are talking about how to treat, how to cure diabetes naturally, okay, or what are the treatment options available for diabetic people, so I think a doctor will be able to create better content than me. I will also be able to create content, but I think a doctor will be able to, add a unique element because they have maybe worked with patients who have diabetes, or maybe while they are studies they have learned something new. So that is why medical professionals will always have an upper edge over non-medical professionals, because they've also seen a lot of patients, right? They have actually seen people with illnesses and getting, treated them. So they bring their unique perspectives.
All right, ma'am. So the next question I want to ask you: can medical writing complement a career in clinical practice, or is it more suited for those who are looking to transition into non-clinical work roles?
I think both scenarios can be true. If you already have your clinical practice, also you can explore medical writing, because I am sure once you understand what medical writing is and what kind of perks it offers, there are few chances that you would continue your clinical practice, which is, I think, also not true, because for clinical practice, you need to be very passionate also. So I have seen my mom and dad, and I've seen how passionately they have treated their patients. So I think both scenarios are true, but you need to decide for yourself, because at the end of the day, we do need doctors, right? If all the doctors are going to do medical writing, then we also have to think that who is going to cure the patients. So I think this is something which a doctor or a medical professional can decide for themselves. But I think both ways can be true. As a doctor, also side by side, you can pursue medical writing and see how it works for you. Also, if you are somebody who now wants to do a non-clinical role, definitely medical writing is a very, very lucrative option.
All right, ma'am. So moving to the final segment of this podcast, that is tips and advices. So, ma'am, what advice would you give to MBBS student or a graduate considering a career in freelance medical writing?
So I think it will be the same advice that first try to do your own research, your background work. Try to find out what are your skills, what are your strengths, what are you good at. So even as an MBBS student, you might be really good at interacting with patients, right? Because see, as a doctor, you're going to, end of the day, you're going to treat patients, you're going to cure patients. But patients also usually have their favorite doctors, right? Because the way you interact with your patient, you give them, you console them, you give them strength, also matters. So I think the emotional part, empathy part also matters a lot in medical writing. So I think be empathetic in all your interactions, whether right now you are studying MBBS or you have become a doctor also. I think the way you deal with patients, just try to understand them beyond their illnesses, be a bit more empathetic, and I think you can create good medical content. This is one advice which I would like to give. And obviously, talk to more people who are medical writers, network, and make use of social media to the best. So use platforms like LinkedIn and Instagram to the best of their abilities.
All right, ma'am. The one more personal question I want to ask you: if you could go back to the time when you started your career in medical writing, what would you do different in your journey as a medical writer?
Uh, a very good question, Amay. I think this advice that I'm giving to everybody through your channel, I would try to apply it first. Because, see, when I started my career as a medical writer, as I said, I accidentally entered this career. If I could go back in the time, I would definitely try to explore this field more, and the formats and all that which I know now, because I keep upskilling and learning. I would have known them better, because see, I knew how to write blogs and all that, but I was really not aware of the other kind of verticals of medical writing, like CME content or a visual aid and all that. So I really struggled at that time to create such kind of content. So I think this is something which I would have done if I had to start from scratch. That I would first gain in-depth knowledge about the career, and then I would have, explored medical writing.
All right, ma'am. We are almost done with this session. So I would like to thank you for taking out your time and coming up for this podcast and sharing all your valuable insights and information with us. I'm sure that this will definitely help to boost the confidence those who are looking to transition from clinical to the non-clinical side of healthcare, and particularly in the medical writing. So that's all for this session, ma'am. Do you want to add up anything?
No, I think this video is going to really be helpful. And again, I would definitely suggest everybody to please follow Amir and subscribe to his channel, because I think he's doing a fabulous job. Apart from his own studies, he's taking out time to put out content and help aspiring medical writers. So please do support him in his initiative.
All right, and thank you so much for your kind words.
Sure.